Hello, my name is Dr. Shelley Johns, and I am an associate professor of medicine at the IU School of Medicine in Indianapolis. And I'm also a health services researcher at the Regan Street Institute. And I'm here to talk with you today about some behavioral strategies that you can use to improve your sleep quality and hopefully get a restorative night's sleep. So I'm going to start by sharing just a few slides with you. We'll go from there. So I wanted to begin by hang on just a second. We always have tech issues when we get started, right? So I wanted to just begin by emphasizing the importance of high quality sleep. And it's because it is such an important component of our physical and our mental well-being. And so that is one of the reasons why the Autoimmune Hepatitis Association has decided to put this sleep school together. So I wanted to just mention that, we all know that when we get a really good night's sleep, we feel better the next day. When we don't get a great night's sleep, sometimes we don't feel, quite our best. In the morning. Sleep is really a unique thing for all of us in that we all have, a different sleep cycle. We all have different amounts of sleep, where we function optimally. So for instance, I function really, really well with 7 hours of sleep, as where, some of my colleagues need a little bit more than that. And so it just depends on the person and, what works best for everyone. The studies have shown, and I'm going to show another slide here in just a few minutes about how many hours of sleep, have the optimal health outcomes. So we'll talk about that in a moment. But chances are most people on the call need somewhere between 7 and 9. And, when we're getting adequate rest, when our sleep is restorative, just all of our bodily systems tend to work a little better. Our metabolism is better, our memory is better, our mood is better, all of those things. Our sleep is restorative, and it depends on the amount and the quality of the sleep that we get. So, being in bed for 9 hours tossing and turning is probably not going to be as helpful to us as if we get, 5 hours of really good quality, restorative sleep. So I just wanted to mention those two parameters about the amount and quality, of our sleep. There are many things that many of us do that can disrupt our sleep. And so some of the things that you can see on the slide here and also on the next slide would be things like, sitting at the computer and working right up until, the time for you to go to bed. That's probably going to be pretty disruptive, to our sleep. Also, using our bedroom for things other than sleep or intimate activity with a partner. Those are really the only two, activities that we should really be doing in our bedrooms, because we want to create a context where our bedrooms and our bed are associated with relaxation and with nothing with anxiety, right? And if we are, working in bed or, watching TV in bed, sometimes that can associate our bed with, thoughts or feelings that are not very compatible with quality sleep. So I always encourage all of the people that I work with in my clinic to leave all the technology in rooms other than the bedroom. So, keep your iPad in the living room. Keep your computer, your laptop in your office, rather than trying to do work in bed. Also, a lot of people end up staying in bed when they're tossing and turning and when they're, really worried about something and ruminating. And then we lie there for hours, sometimes wide awake, and then worrying about, not being able to sleep tonight. So I will just encourage you that if you are having one of those restless nights sleep where you're really not feeling sleepy, I would encourage you to perhaps get up and do something that's very relaxing and pretty boring. So you probably don't want to get up and watch, TV if TV engages you, but you might want to read even the most boring book, that you have on your bookshelf, a book that you're really not that into, because that will help you to be able to perhaps resume sleep more quickly. And then also, not having a very, a restful environment. In order to get the best quality sleep, our bedrooms need to be cool, they need to be quiet, and they need to be dark. So doing anything that you can to make those changes can be really helpful. And here I've listed just a few other sleep disrupting activities. And, I invite you to make note of some of these where you're like, "Ooh, yikes, that's, I'm doing that one," because those would be some things that you could set as a goal for yourself to address to try to improve your sleep quality. So one of them is doing a lot of napping, or napping for more than 20 minutes at a time, or like this woman on the slide, falling asleep on the couch in front of the TV in the evening. Sometimes we kind of trick our bodies into thinking that, if we've slept on the couch for an hour, when we've fallen asleep, after dinner and watching television, sometimes we trick our bodies into thinking that we've slept, that's our night's sleep, and now we're up and we're ready to go. So that can really interfere with falling asleep at bedtime. So I would invite you to do whatever you can. If you are getting sleepy in front of the television, get up and do a few stretches, some gentle stretches, or do some activity, like knitting, or something that can keep your hands busy and keep you engaged so that you can stay awake until it's time to go to bed. And then also, when we don't get a lot of sleep during the week, but then we really want to sleep in on the weekends, that variation in our sleep cycle can be really disruptive. And so if you are someone who is some sleep disturbance, you might want to think about having a structured bedtime and a structured wake time, and then staying fairly consistent with that, within an hour each way, 7 days a week, because that can be the healthiest cycle to set up. And then I've also listed some of the things related to food and drink that we want to keep in mind. So not having a large meal, before bedtime, or a large snack, not eating spicy food, too close to bedtime. Alcohol is another tricky factor. Having alcohol within a couple of hours of bedtime can actually disrupt our quality of sleep. So kind of keeping that in mind, having a nightcap if you wish, but if you have sleep disturbance, you might want to lay off of that until your sleep quality has improved. And then also, not drinking too many fluids before bed, because that is just going to mean that you'll have to probably get up in the middle of the night to use the bathroom. And if your sleep is disturbed, you may not want to, to be doing that. So I wanted to show you, I had mentioned before, need 7 to 9 hours of sleep a night. This is a fairly recent study that was published a few years ago. It was a large study, an examination of 60 different prospective cohort studies, which found that there was a U-shaped, curve that you can see on the screen there, where you see that the lowest part of that U-shaped curve is at the 7, and that's 7 hours of sleep a night. And so what they found in this study is that a relationship between sleep duration and all-cause mortality, dying. And so what they found is that 7 hours of sleep a night provided the greatest protection in terms of, mortality. So what this really means in a practical sense is that compared with 7 hours of sleep per night, A 1 hour decrease in sleep, so like 6 hours of sleep a night, was associated with a 6% increased risk of mortality or dying. And the results were even more pronounced for people who got more than 7 hours of sleep a night. So a 1 hour increase in sleep duration was associated with a 13% increase in mortality. So what this tells me is that 7 hours is a pretty good amount to stick to based on the evidence that we've just reviewed here. So if you are somebody that you feel like your body really needs a little more than that, clearly you need to do what your body needs. But this is what the evidence would suggest in terms of sleep duration that's optimal, and it's 7 hours across large numbers of people. So I also, many people have sleep disturbance, but not everybody has, full-blown insomnia, which is a psychiatric diagnosis. So I've listed for you here the main diagnostic criteria for insomnia. And you can see, on the slide here that it's, insomnia means, dissatisfaction with your sleep quantity, the number of hours of sleep you get, or the quality of your sleep. And it's causing problems in terms of, problems at work, social problems, or other important areas of your functioning. And the insomnia can affect, having, problems falling asleep. It can be problems waking up, a few times in the night, or it can mean early morning awakening where it's like, oh my gosh, I'm awake every day at, 4 o'clock in the morning and I don't need to be. To be insomnia, it needs to affect you or affect a person at least 3 nights a week for at least 3 months. So this just isn't having, a couple of bad nights of sleep in a week. Oh, I've got insomnia. It's more of a longer term issue that affects you, 3 nights a week, for at least 3 months. And it's where you have the opportunity to sleep. Like for instance, there are a lot of shift workers who maybe don't have the opportunity to sleep. That's not what we're talking about here. We're talking about people who have a chance to sleep, but they just can't, or they're having trouble in that regard. And we also want to make sure that we rule out other potential causes, of sleep disturbance besides insomnia. Is it caused by, substance use or abuse? Is it caused by another medical condition or another mental disorder? So the other thing that I wanted to mention is that the estimates are that somewhere between 10 and 30% of Americans have insomnia, a diagnosis of insomnia, or have trouble with chronic insomnia. And it tends to be a little bit more common in women, and it tends to be a little bit more common, the older that we get. And it also tends to be more common when we have other, medical issues, possibly because of, all the medications we take that can disturb sleep. So what I've listed for you here are some of the factors that are involved in insomnia. And you can see in the black row, we've got predisposing, precipitating, and perpetuating factors. And what I mean by predisposing factors, that would be things that we can't really do a whole lot about. So we're not going to spend a lot of time on those, but those are oftentimes things that we're kind of born with, or things from childhood. The perpetuating factors that you can see on the slide are things that we can have some influence over based on our coping skills. In terms of situational stressors, we can learn some really adaptive coping skills that can help us to manage those with greater ease. If we're diagnosed with a medical condition like autoimmune hepatitis or an associated condition, we can learn how to effectively manage our condition. We can get, we can have, conversations with our healthcare team, to try to get on the right path, in that regard. Some of these perpetuating factors are the things that just make it stick. And so that's where we want to try to do some behavioral changes that we'll talk about next. So some of the treatments for the precipitating factors include things like stress management that we talked about, as well as improving our sleep hygiene. And you can see a couple of strategies on the right-hand side of the slide. And I believe there's one other component of this sleep school that covers a lot more detail on sleep hygiene. And I also wanted to say that one of the number one evidence-based treatment for the precipitating and perpetuating factors is called cognitive behavioral therapy for insomnia, or CBTI. And so we'll take just a couple of moments here to talk about CBTI, what it is, and what it involves, and then how you might be able to access this, if you so wish. So CBTI is a brief, evidence-based and structured approach that explores the connection between the way we think, the things we do, and how we sleep. It's a multi-component intervention that's usually delivered by a therapist or a healthcare provider who's been trained in this specific intervention. But it involves cognitive interventions, like learning how to change the way we think about sleep. So for instance, I listed an example for you. A common thought that oftentimes disrupts our sleep, excuse me, is that I will not be able to function tomorrow if I don't get sufficient sleep tonight. And that is a common thought, but it's one that actually only creates anxiety for us when we're laying there at 4 o'clock in the morning, not being able to fall back asleep. Usually what we just need to tell ourselves is, 1 or 2, nights of sleep where, that are disturbed, probably not going to make a big difference. If it goes on night after night after night, I may start to notice it affects my mood, my ability to think and concentrate. But one poor night's sleep usually doesn't mess us up too much. And so we just try to turn the volume down on some of the disruptive thoughts that we have. The behavioral interventions can include some of the things that we'll talk a little bit more about in here in just a moment, but it's things like, keeping track of our sleep, logging it, monitoring it so that we can see what are some of those disruptive factors that we have so that we can take action to rectify those. Doing things, like relaxation training, like learning how to relax our bodies. Also, stimulus control means trying to make sure that we use our bedroom and our beds for sleep and for intimate activity only, and not some of those other disruptive activities that we talked about. And then CBTI also includes a lot of psychoeducation about, learning what some of those effective strategies are that support and enhance our sleep quality. So the other thing that I'll mention is that CBTI is highly effective. It's the only treatment, including medications. It's the only treatment that has a strong recommendation for treatment for chronic insomnia in adults from the American Academy of Sleep Medicine in their clinical practice guidelines. The evidence for medications for insomnia are weak. It's not because they don't work. They work fine in the short term, but we're really not supposed to take them for very long. And then as soon as you stop taking them, oftentimes your sleep quality is worse, for a little while. And there's also some safety issues with regard to the pharmacologic or the medication, pharmacologic interventions medication. So that's why, really the primary recommendation for treatment of chronic insomnia is CBTI. So I wanted to give you some options on how you can access CBTI if you're interested in it. So you can click the link, or you can jot down this link to go to a directory of people who have been trained, interventionists, therapists, and healthcare providers who've been trained in this approach. And then you can see if there's anybody local for you. The other thing is, it's pretty straightforward treatment. And so there are a couple of self-help books that you could access, and I've listed those for you. Both of them have where you can read the first chapter or the first few pages online if you go to Amazon. So you can just put in the title and then you can read a couple of pages of each book to see if it's your style. I've actually used and recommended the top one many times, and most of the people that I recommend it to have really appreciated it and felt like it was very straightforward. There's also an app that's available on both for iPhones as well as Android, and it's called the CBTI Coach. And you can go into your app store or wherever you get your apps. It's free, so that's good. It was developed by the Veterans Administration here in the US. The other one is it's an online approach, and it's called Somly, SOMLY. So you can check both of those out if you're interested. So I wanted to end with a few behavioral strategies that we've already kind of alluded to, but I just wanted to just give you a few more suggestions. So in terms of your bedtime routine, I would encourage you to do the same things before going to bed each night. Just kind of get into that routine, go to bed and get up at the same time every day, just to set that really healthy routine. The next one is called sleep compression or sleep restriction. And this is a big component of CBTI. And that's where, instead of laying in bed hour after hour awake, tossing and turning, worrying about your sleep, when you are tossing and turning, I invite you to get up, get out of bed. If you've been lying there for more than 20 minutes, I invite you to get up, do something else that is incredibly boring until you feel sleepy, and then go back to bed. Again, just so that you can get that healthy relationship with your bed and bedroom. And then also using the bedroom, only for sleeping and intimate activity. We've talked about this before. The other one is relaxation or mindfulness. And on the autoimmune hepatitis sleep school website, you will see a link to some mindfulness recordings that I've made for you. They're each 10 minutes, and they are really about learning how to be fully present in this moment. Because when we're lying there unable to sleep, oftentimes our minds do what? They go to the past, where we ruminate about how our day went and all the things that we said or did that we shouldn't have said or done, which can get us really anxious. Or our minds go to the future, the uncertainties of the future and how it's going to be, and those sorts of things that we can't predict and that we can't control. And so most of us find that when we can really focus on this present moment, using the breath as an anchor, noticing, the next inhale and the next exhale, using sound as an anchor, or just noticing the way the sheets feel against your legs as you're lying in bed. Those sorts of activities, those sorts of focuses, that kind of focus for our attention can really help us to be able to arrive for rest and access sleep with greater ease. And there's lots of evidence to support the efficacy or the effectiveness of mindfulness to help us with emotional regulation as well as with accessing sleep. And then, also, keeping track, of your sleep, using one of the logs. I think one of the other presenters talked about that, so that you can really look at your patterns and see where the problems are. And so I wanted to take my slides down and offer one more quick suggestion that is one that oftentimes has been very useful for some of the folks that I work with in my clinic who have sleep disturbance. And that is, if you are somebody who wakes up in the middle of the night with busy mind, you have lots of worries, lots of concerns, tend to be a little bit, tend to ruminate on those sorts of things, as many of us do from time to time. I would invite you sometime between, after you get your dinner eaten and your dinner dishes done, and at least an hour or so before bed, I would invite you to sit down with a notepad or even a note card. I usually have some note cards handy, and make a list of the various topics, issues, thoughts that are on your mind that are worrisome, bothersome, or that you think might keep you up tonight, and make the comprehensive list. I probably wouldn't spend any more than 10 minutes or so, 10 or 15 minutes creating the list. And then after you get the list together, then come up with some sort of a soothing ritual for you, where you can place the card in a place, maybe in your desk or, on your table, where you can address the issues in the morning, because most of the things on the issue, or on your card, are not going to be things that you're going to be able to fix tonight, right? Usually those are things that are light of day problems, where you're going to need to make a phone call, or you're going to need to solve a problem, or you're going to need to take some action. So, but having the comprehensive list can help turn the volume down on the disruption of our sleep at night. And once you have that done, then I would invite you to do some sort of a healthy ritual. Sometimes what I do is I'll just have a nice cup of non-caffeinated, like chamomile tea or some other, type of warm tea. Or sometimes I'll say a prayer, or sometimes I will just light a candle and I'll read like a little passage that I find inspirational, and then I will kind of close the book on that, blow out the candle, and realize that I will take care of whatever's on the list tomorrow. So those are just a few suggestions to help support your healthy sleep. I wish you a restorative night's sleep tonight. Thanks.